Hi, everybody. I'm Christy Prada. I'm the Vice President of Business Development at Maple, and I'm going to talk today a bit about how Maple is disrupting the healthcare industry. And to us, that means a couple different things. First, it's thinking about how to apply technology to problems that we're dealing with every day, but it's also about thinking about new business models for solving those problems. Right? You need to have the tech, but also the business models to tap into. So I'm going to talk a bit about that. So, and apologies, the font is a bit weird on these, so sorry about that. That's our corporate fonts that don't transfer over, but we'll go with it anyway. As we all may know, on a day-to-day basis, access to care in Canada still remains a critical issue. While we have one of the best healthcare systems in the world, arguably in many ways, one of the things that we struggle with is access to primary care. We're among the worst nations in the developed world with respect to access to primary care. And that's manifest in a few different ways. You can see here some data around how often people are going to emergency rooms for things like simple problems. Our CEO is an emergency room doctor, and he can speak to this. He sees this every day in the emergency room, people coming in because they don't have access to a physician for same-day care. So about 66% of Canadians report going to the emergency room for access to care. The other challenge around this is where physicians are located. We're a very geographically diverse country with people living all across the country. 17% of our population lives in rural and remote locations, yet 92% of physicians are actually located in urban locations. So it's been a challenge moving that physician capacity around. On the flip side, the reason there's a lot of opportunity here is because there's actually a lot of physician capacity that's untapped. And there's a variety of reasons for that. One good example is an emergency room physician works an average of 16 shifts a month. So they'll have, quote unquote, a lot of free days in the month. And if you'll ask our CEO if he would ever take on another day shift in the ER, the answer would always be heck no. So a lot of untapped capacity there that exists in the system because of a variety of different constructs around how physicians are contracted and how they use their time. There's also a misnomer that we don't have enough physician capacity in Canada. We actually have physician capacity growing at a pace that's outpacing the Canadian population. So we have about 12% growth of physicians year over year between 2014 and 2018 compared to a 4.6% growth in population. So really the problem that we have here is actually a capacity allocation issue. It's not a shortage. So what Maple's started to do is to find a new and creative way to tap into that using technology and new business models to redistribute that capacity and also tap into new approaches to how people use and access care. So what we've done is we've created Canada's first and only 24/7 virtual care platform in Canada. We are national. We offer Canadians everywhere in Canada the ability to log into the app, and they can request a physician, in fact, in less than 2 minutes, which is pretty amazing if you compare this to wait times in the public system. What we've really done also, or the way we've done that, is by tapping into that physician capacity, right? And giving them a way to provide care in a way that fits into their schedule and doesn't require them to take on extra shifts or things that don't match the way that they want to be providing care. We've given them a flexible way to do that. You can kind of think about us as similar to Uber. I know sometimes I hesitate to say that in this day and age. There's some connotations around that. But what we've really done is we've taken Uber's model of efficiently matching supply and demand in a flexible way to match together patients with doctors when the need arises. That's how we're able to do the access to physicians in less than 2 minutes. Within the application itself, we also have given doctors the ability to do basically everything you could do in person, with the exception of physical examinations or where you have to lay hands on a patient. But doctors in the application can write prescriptions. They can do lab requisitions where patients can take them into labs and get the results sent back to Maple or back to their family doctor. They can do imaging. They can even do specialist referrals, and they can chat either over instant message or over video. And a lot of things can actually be dealt with through a discussion of symptoms. If you think back to the last time you were in your doctor's office, how much time did they really spend laying their hands on you? Most of it is a discussion of your symptoms and sharing of your medical history, and relying on patients to be empowered to share that information with the physicians during the interaction. The other big thing that we're doing is not only creating the ability for patients and doctors to connect, but also trying to build up more empowerment of patients by creating an ability for patients to track and store medical information online. There's a lot of proof that shows that when patients are more engaged in their care and have access to their own data, they will have better outcomes. So we're starting to tackle more problems around the Canadian healthcare system by making data available in a consistent way online that can be shared across doctors on the platform, but can also be shared with doctors in the physical world as well. Lastly, of course, we're bilingual. That's important in Canada, of course, and especially when you're providing coast-to-coast coverage. So we've been able to think really efficiently about how to tap into the right types of capacity to make sure we can provide a scalable service in both English and French. And then, of course, privacy is very, very important in this day and age. It was talked about earlier in the talk about AI. Very, very prevalent to make sure that everything's done so in a way that is maintaining patient safety and patient data protection. So we've done that as well. Really, here's some screenshots. Wow, that looks really bad. Sorry about the font again. But you can see the screenshots there. Really what we've done here is we've used technology to tap into that capacity and spread it across Canada in a scalable way. So you can see here, patients can log into the app, they can select what their symptoms are, they can do this at any time of day, right? They don't need to wait for an appointment that may or may not fit into your schedule. If you have some time on your lunch break or after work or on the weekend, 3 in the morning, you're able to log in, select your symptoms, you get paired with a doctor who's licensed to treat you. That's another really interesting component of the model. In Canada, every province is a little bit different with respect to the rules around who can be treated virtually. So another thing that enables us to be scalable is we're sharing that capacity across provincial borders where we're able to. We have some doctors that are cross-licensed in multiple jurisdictions, but we also are taking advantage of provincial rules where some provinces will actually let a patient from that province be seen by a physician from another province. So it's really taking care to the next level by making it really scalable and sharing those resources across different provinces and even within one province, right? That stat I shared earlier about how a lot of physicians are located in urban locations, hard to get that capacity to go out to the rural areas without asking them to, travel or relocate their families. In this case, they're able to provide that care without having to disrupt their life. Lastly, as you can see here, there's a little chat screen with the doctor. It also can be done via video. And then at the end, we have the ability to send prescriptions to any local pharmacy in Canada. So really what we've done here is taken, the current model of care, made it more scalable, more accessible, and in a way that fits into people's lives, but then also physicians' lives, which is very, very important. In terms of Maple, so we've been around for just under 5 years. It'll be our 5th birthday in August. We've actually only been providing care to the general public for about 4 years. So that first year and a half, what we were doing was really building the application. So we built all of the technology in-house. One of the benefits of doing that when you're trying to disrupt a business model or a care delivery model is that we're able to iterate. We're able to take really creative approaches and try things out. And if it doesn't work, we can change it. We do that a lot. We'll bring in a new functionality and test it out with our users. We did extensive user testing with patients as well as with physicians because we recognized it was important to have an app not only that patients liked and wanted to use, but that doctors liked and wanted to use. And we're constantly iterating on both of those pieces, which is very important. In this short amount of time, we've made a lot of progress. I think that's because of our iterative approach to developing models and interacting with patients and improving the technology. We have over 500,000 Canadians that have access to the platform, and that's growing month over month, on average at a rate of about 15%, which is fantastic. We have over 400 Canadian physicians on the platform with a wait list that's almost as long. So one of the keys is managing that capacity to say, okay, we need to find the right pace at which we're bringing physicians onto the platform so that you don't have too many physicians and they're not engaged enough, or you don't have not enough physicians and patients are waiting too long. It's a bit of a fine balance. So we've really gotten become operational experts at managing that supply and demand and making tweaks as we grow. Average wait time consistently on the platform to date has been 1.45 minutes, which we're very proud of. We always aim to keep it under 2 minutes, and if you don't believe us, try it out yourself. People always say, how can it really be 2 minutes? But it truly is for any of our clients, any of our employer clients, insurer clients, public sector, or any consumer who just picks up the app, downloads it, and tries it out. Our wait time is consistent. We have a 91% first-time issue resolution rate, which is really important because when you think about shifting care into the virtual environment, you want to be doing so in a way that you're actually solving issues and not creating extra time for people. The reason we're able to have such a high issue resolution rate is because we have the physicians that are actually doing the triaging, which is another really important thing that we've disrupted, I would say, from the public or the physical system, right? When you go into the emergency room, you get triaged by a nurse, and then you get put into the room and eventually see the doctor. In an online setting, we don't have to leverage that model. We can actually have the doctors review every single request that comes in, and in fact, they like that because then they know any visit that they're treating virtually, they've had the opportunity to review the request and determine, yes, it's appropriate for virtual, and they're picking it up. So the patients are happier with a quicker wait time, and the doctors are happier because they're treating visits that they personally got to select and determine were appropriate for virtual. That's also driven a higher issue resolution rate because it means that visits that are flagged as emergency are sent directly there. And when you have the physician doing that triaging as well, they're the best to predict whether or not they can treat the patient because they're the ones that are actually going to be on the other end talking to the patient. And then lastly, we've had a lot of progress as well, not just working with the direct-to-consumer model, but working with new businesses, clients across the spectrum. So we have over 90 clients, and that spans insurers, employers, governments, agencies, as well as ministries as well. And I'm going to talk here just for the last minute about one of our projects in PEI. In the article in the Rotman magazine, I talked a bit about some of the disruptive models we're using for innovating and working with public sector partners. In this case, what we did in PEI is we worked with a hospital to bring our platform into the hospital setting to allow that hospital to use physicians to remotely treat into the hospital. So this is a hospital in rural PEI that was basically on the verge of closure, and they reached out to us and said, hey, do you do this? And we said, well, of course we do. We built them a new platform to do that. And it wasn't just us going away and building a platform that made this successful. There's a few different things that we did that made it really successful and innovative, and it was a big part of this was the co-design approach that we took. We didn't just go away and build it on our own. We worked collaboratively with the stakeholders on the ground, with the physicians who would be using it, with the patients who would be, did some patient interviews with the patients that would be seen in the hospital. And then most importantly, we also worked with the hospital folks on the ground, with the nurses, with the ward clerks, with everybody that would actually be using it to say, how does this fit into your workflow? And let's try this out and then iterate on it through a pilot. That was really, really important, and I think a really unique thing that you don't see a lot of in the healthcare system, that co-design between clinical staff and technology companies. The other really important thing was government buy-in and support. We worked with Health PEI to adapt reimbursement models for physician payment. So right now, as you may or may not know, physician payment cannot generally be compensated for if it's provided virtually. So the government actually gave us an exception to allow physicians to virtually treat into the hospital and still bill the government for those visits. So that took a lot of interaction and engagement and defining what the best use case was, defining what the different parameters for success would look like, and measuring and tracking that really closely. But having that partnership and support from Health PEI was critical. Lastly, I would say, it wasn't also without generous federal and provincial grants. So we applied and took advantage of a variety of different grants that are available to technology companies in Canada and Ontario. So we took advantage of the OCE Talent Edge internship program, which allowed us to bring in a director to test out this model and run the program. That director is still with us today, luckily. We also took advantage of the IRAP program, which many new technology companies are taking advantage of, which allows funding for tech companies who are building new products and solutions to help service the provincial or federal government. So very lucky to have taken advantage of those. And I think all of these different pieces were critical to our success. It wasn't just us going out there doing our own thing. We worked very closely and took advantage of different avenues to do that. So that's Maple. Any questions at all, feel free to reach out after. We're always happy to hear from people or hear feedback, or if you have any ideas about an innovative idea you want to use virtual care to tackle, we're all ears.